Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening and welcome to the special focus. My name is Zahid Jadwat and we are together until 8 p.m. once again right here on Salam Media. Coming up this evening, we are going to be assessing the state of South Africa's healthcare system. Now, the coronavirus pandemic has tested healthcare systems around the world. Much like it has for the rest of the world, the pandemic has thrown an unprecedented challenge at South Africa's already troubled healthcare system. So tonight, we try to find out what it would take to save the system and prepare us for future challenges. Let me introduce you to our guests for tonight. Firstly, we have Professor Mosa Moshabela, who is the Dean in the School of Nursing and Public Health at the University of KwaZulu-Natal. Welcome to you, Professor Moshabela.
Very much. Thank you.
We also have Professor Laetitia Rispel, who is the former head of the School of Public Health at the University of Witwatersrand. Welcome to you, Professor Rispel, as well. Professor Rispel.
Good evening, Zahid.
Okay, thank you for joining us. Let me now also introduce, last but not least, we have Dr. Flavia Senkubuge, who is the Specialist of Public Health and the Head of Health Policy and Management based at the University of Pretoria. Thank you for joining us to you as well, Dr. Senkubuge.
Assalamu alaikum, Zahid, and also to your listeners.
Well, and thank you for joining us. Okay, so let's start with you, Professor Moshabela. So we know that the South African healthcare system is under quite a bit of pressure. Of course, the COVID-19 pandemic has applied further pressure to the situation. So if you could just let us know, to give us a background to what we are dealing with exactly, what is the current situation of South Africa's healthcare system?
Well, Zahid, that's a big question, and also I think it's a question that you should also address to Professor Rispel as well, because she has a lot of experience working with the South African health system. But I think overall, I would say that the South African health system is work in progress. It is not fully developed yet. It has come a long way over many years, and it has made a lot of strides, especially the public health system in terms of providing primary health care, maternal and child health, and also being able to accommodate the pressure to respond to HIV, AIDS, and TB. So in many ways, it has come a long way. But of course, it's got problems. You know, when you think of it, it is not equitable in the sense that it does not necessarily serve and also benefit all the people that need health care in a fair manner. So you can see the difference between the private sector and the public sector. You can see the difference between rural areas and urban areas. You see the difference between provinces. You see that people of different socioeconomic status are benefiting differently. The ones who are poorer are benefiting less from the healthcare system. And of course, all of these things basically are the characteristics of a healthcare system that is not necessarily fully developed and is not equitable.
Okay, so Professor Rispel, I just want you to weigh in there if you might want to do so. So Professor Moshabela says that the South African healthcare system is a work in progress, and it has come a long way. Do you particularly agree with this particular narrative, Professor Rispel?
Yes, thank you, Zahid. Professor Moshabela has already highlighted some of the complexity, but I think we have to make a distinction between the public and the private healthcare system. So in the case of the private sector, it's very well resourced. It's often very strong in our cities and urban areas. It often draws skilled health professionals away from the public health sector, and by all accounts, it's probably not under pressure. The question that you started off with. Contrast that with the public healthcare system, which takes care of the majority of the South African population, probably around 83%. It's under-resourced, and there's also been underinvestment in the public healthcare system. And what the COVID pandemic has done is to highlight, to lay bare some of those inequities. both between the public and the private health sectors, as well as between urban and rural areas. So across the 9 provinces, you see a very different kind of capacity to deal with the COVID crisis. So COVID, in a sense, has exacerbated the fragility of the health system, of the public healthcare system in particular, which is under severe pressure.
Mm-hmm. And so just on that note, I'd like to ask you now, can the public healthcare system in particular actually cope with this challenge and this pressure that has come upon it by the COVID-19 pandemic, or is this now the breaking point for our public healthcare system? Professor Rispel?
So Zahid, it's not a straightforward question to answer because of some of those complexities that both Mosa and myself have highlighted. So I would want to turn the question around because I think it's in our interest as South Africans to make sure that the system doesn't break. And so I'm going to turn it around and I'm going to say what would be needed, in my opinion. I know you're going to come to it later on again, but I just want to say what is our collective efforts to make sure that the system doesn't break. Firstly, I think government in particular should look at the strategies and design strategies for that are pro-poor. And so, for example, it's a strategy that needs to say, how do we kind of take cognizance that there are large numbers of poor people in South Africa? And how do we address the social determinants of health? What do I mean by the social determinants of health? Are those things like food, for example, that people need? It's clean water and sanitation that they need. And then combined with that, it's also a partnership with communities to actually say to people, look, we're in this crisis together. Let's jointly actually develop a solution. The second aspect, I think, is that we also need to invest in the people that deliver healthcare. So the health workforce, the frontline healthcare workers, and again, partner with them to actually say, well, how do we actually prevent people from having to go to hospitals? And my last point, I mean, it so happens that all of us on your program tonight are public health people, you know. So what COVID in a sense has taught all of us a little bit of humility, because the information is changing rapidly every day. Although there are many experts, but a day later you actually discover that perhaps you're not the expert that you thought you were. And so COVID is teaching us that the kind of very basic public health measures are the things that work. What are those? Hand washing, wearing a mask, avoiding crowds, social distancing, a kind of washing again, hand washing over and over again becomes our most effective weapon against this pandemic, And so it's a combination of those measures to actually say, how do we protect the health system so that large numbers of people don't have to be admitted to hospital and therefore will overwhelm that health system. And perhaps the last point to make, Zahid, is that it's very difficult in a short space of time to kind of what Professor Moshabela calls work in progress. We can't, it's going to take a very long time to fix the health system, and to actually get it to really be equitable and to provide a decent quality care for the majority of the population. That's going to take years, to sort out, And so we're not going to be able to do it overnight. So it's going to require a collective effort from all of us.
Indeed, and of course we will, as we go further into this discussion, we will unpack the various ways which we can perhaps try and lighten the burden on the healthcare system, and perhaps try to find ways how we can sort the problem that we face at the moment. But before we do that, let's actually just try and understand the situation at hand and the issues that we currently are facing in the public healthcare system. So over to you, Dr. Flavia Senkubuge now. As a country, we have taken strict measures. Our government has taken measures to now assist the healthcare system to now equip itself to deal with the COVID-19 pandemic. And some of these measures, such as the tight lockdown, which have been aiming to flatten the curve and prepare our hospitals, for example, how effective have these measures been? Have they bought us enough time to adequately equip our healthcare system to deal with the influx of people possibly needing healthcare during the pandemic? Dr. Flavia?
Thanks, Zahid. And I think, as Professor Rispel said, one of the things that this pandemic has showed us is the importance of evidence. So it's always so difficult to answer the question of, are we prepared enough? But what one can say, we are better prepared than if we didn't have a lockdown, that's for sure. And preparedness is not only just in terms of the hospitals. And I think this is kind of the messaging that's gone out, that we just only preparing hospitals. But the COVID-19 pandemic is showing us that health does not only belong in kind of the health system, but there are other systems that affect health. So for instance, one of the things that we had to prepare is to ensure that while we are locking down, children are able, say for instance, children who are in boarding schools are able to go home. We're able to prepare those schools. Institutions of higher learning are able to kind of put policies in place in terms of remote learning and, you know, those kinds of things, making sure that, you know, counting and saying who are these people who are in our community who may be affected adversely by the COVID-19 pandemic. And so in as much and as it has been important to prepare our hospitals, and also I think the important question that Prof. Moshabela also talked about is actually looking at the public health system and say, what do we have, what do we not have, and do we have enough personal protective equipment for our health professionals? Do we have you know, enough human resource capacity? And so you will see that during that time, we brought in, you know, doctors, we called in retired health professionals to come in. So if we hadn't had the lockdown, we wouldn't have been able to sit down, put committees together and, you know, start with the thinking around what next. The other thing, of course, Zahid, which, you know, may seem very minuscule, but very important, it also helped us as a nation to mentally prepare ourselves that something is happening in our community and it is going to be business unusual. And so for instance, the doctors who are in the front lines, you were able to say, okay, I need to mentally prepare myself for being on the front line. I need to prepare my family, grandmother, grandfather, mom, dad, children, and that type of thing. And also as a community and a society, we were able to have these conversations at home and within our own communities, whether it's via Zoom or phone, and say, you know, it is business unusual, and what are these steps that we need to take? Because remember that being healthy does not, it ends at the hospital, but it actually starts at home. And so by families having these conversations about, you know, we need to keep ourselves healthy, we need to wash hands. This is what WHO is saying, how we should wash hands. That already started the behavior change that we needed to have, and in order to steer us to deal with the pandemic as we have it right now. So that's a very important thing that the lockdown assisted us, not just for hospitals, but we need to look at it a little bit broader than just preparing hospitals.
And of course, now I'd like to find out what exactly is where exactly does South Africa's healthcare system stand in comparison to the rest of the world? We do know that most of the world has faced pressure from this pandemic, because it's something that nobody really expected, say for example 2 years ago, and we wouldn't have really had enough time to equip ourselves for this pandemic. It's just how it is. So I'd like to know now, where does South Africa's healthcare system stand in comparison to the rest of the world? Professor Moshabela, in knowing that you guys are the experts in this health sector, you might know some of more of the issues that our healthcare system faces. So if you could just perhaps give us an idea where our healthcare system stands.
Yeah,
in
Zahid.
comparison to the rest of the world.
Yeah, I mean, it's a difficult question, but I think based on the metrics that we would normally use, for example, in terms of the World Health Organization metrics, the point of the healthcare system is to ensure the health of the population as a whole. So we would use all these health outcomes to assess where our health system stands. And we often compare it with how much we invest as a proportion of the GDP. And so in South Africa, we would spend about 8% of the GDP on health. But at the moment, I think based on the current estimates, we are bottom of the pile. We are in below the 10% of countries that are under the World Health Organizations in terms of our ranking. So we are around 175 out of 190 countries in the world. And so this is not good. But what has been interesting with COVID-19 is the fact that, and just to say that part of the reason this is the case is all of the different issues we've discussed, especially the fact that we've got a fragmented system between the private and the public. We are not necessarily catering for the people who do not have the means. So it is not fair in terms of the way we provide services. We don't benefit those people. So, and the other thing I want to highlight is the fact that and I think Dr. Senkubuge mentioned this, that we tend to focus more on the curative services. And we've seen it even with the COVID-19. We talk a lot about hospitals and doctors. We don't necessarily emphasize what happens in the community, in the household, what people themselves can do. So we don't emphasize the prevention and the health promotion aspect of health and well-being. And because of that, we basically, it's almost like we are standing, the metaphor of standing at the bottom of the river and pulling out people out of the river who are drowning and resuscitating them without ever taking the time to go upriver to prevent whatever is throwing them in. So, or allowing them to drown or fall into the river. So it is that we don't necessarily do a lot of prevention very well, a lot of health promotion. We emphasize more the curative aspect. And so our health outcomes, therefore, would be poorer. And we saw this also with COVID-19. A lot of our preparations were very much about preparing hospitals, preparing laboratory services, and so forth. But we didn't really take the time early on to prepare the population in terms of what they needed to do, what role they needed to play. It was only much later that we started talking about hand washing and wearing masks and so forth. And even now, we've started talking about behavior change. But we should have been talking about this early on. In fact, if our healthcare system was such that we're emphasizing these aspects of health promotion and behavior in health and well-being, we wouldn't be in the position that we are in now in many respects. But having said that, I think that it's important to acknowledge that even some of the countries that are ranked to have the best healthcare systems in the world, like France and like Italy. I mean, the Italian healthcare system collapsed because of the pressure that it went under in terms of COVID-19. And they ended up with a high mortality. So the fact that they had a very high ranking in terms of the healthcare systems, the public healthcare systems, did not necessarily put them in a better position. The UK is in the top 20. We've also seen the healthcare system struggle under the strain of COVID-19. So it is not to say that because we are bottom of the pile, then, you know, we are condemned to failure. I mean, Brazil, for example, is more comparable to us. We are seeing the healthcare system struggle, even though we were looking to them in terms of some of the lessons around how to improve our healthcare system. There's a number of factors, and and in those factors, you'll see that issues of governance would also stand out. But just to say that, all of these things, I think for me, they come together to say that even though we are bottom of the pile, we should not miss that opportunity to actually make the necessary stride that we can make. It's the first time that we see our health minister and president being so hands-on with the public health system. That for me, I see as an opportunity. And we could take from that to say, can we do this differently? When we move forward, things must not stay the same. Things must be better, and there must be better investment, better coordination, and we must make the difficult decisions that we've been avoiding to make in order to ensure a better healthcare system for everyone.
Yeah, and one of the points which you mentioned is that South Africa is like perhaps ranking at around 175th out of a list of countries, which I think you said out of a list of countries of 195 countries across the world, we currently stand at 175th. But at the same time, you see, that would show us that we have quite a bit which we need to do in order to catch up with the rest of the world. And at the same time, you said that France and Italy also took a lot of strain and a lot of pressure from this pandemic. And Italy, as you mentioned, in fact, collapsed as well. Their healthcare system collapsed. So there's something we need to sort out here in our healthcare system. And just apart from the COVID-19 pandemic, I now want to speak about the issues which the healthcare system has been facing for quite some time now, not just during the COVID pandemic. Before that, now, for example, all medical training takes place in the public sector in South Africa, but 70% of doctors go into the private sector. Now, what is keeping doctors away from the public sector, and what impact does this have on public health care, Professor Rispel?
So again, Zahid, it's a combination of factors. You might be familiar with the health market inquiry into private healthcare services that was done by the Competition Commission and chaired by Judge Ngobo. And they released an extensive report on both highlighting the inequities between the public and private health sector, but also the fact that there's the existing legislation, there's insufficient stewardship of the private health sector. So some of the things that Professor Moshabela talked about, and our relatively poor ranking compared to other countries, it's also accounted for by a very large private sector. So even though we spend quite a lot of money, 8% of gross domestic product on, or actually a bit more than that, on healthcare, half of that is actually spent in the private health sector, which only accounts for about, or only caters for about 16-17% of the population. But coming to the issue of doctors in particular, it's a combination. So I would say it's some of the factors relate to structural issues. So what do I mean by structural issues? In that I think there's insufficient regulation of the private health sector, and probably insufficient stewardship of the entire health system to make sure that there is equity. There are also certain pull factors. So in the private sector, doctors, the workload, doctors in general, they work as autonomous private practitioners. And so they work independently. The workload is not as high or as heavy as in the public health sector, and working conditions are also a lot better. So those are some of the pull factors. But I just want to highlight, Zahid, is not only that that doctors work or a large proportion, or especially medical specialists, are in the private sector, but even those that work in the public health sector often do a private practice, and so that also impacts on access to care and to the care that's provided to public sector patients. But I think we also have to recognize that there are a whole lot of push factors in the public health sector. So these are often, poor or in some instances incompetent management. That there are staff shortages, which obviously means that people work incredibly long hours. There are sometimes, both equipment shortages as well as medicine shortages. And, working conditions are a lot tougher in the public health sector for all these reasons that we've already talked about. Very, very heavy disease burden, large numbers of patients that, that have to be, to be cared for. And so these are some of the sort of the push factors. But I think we cannot look at these factors in isolation of those broader issues, broader structural issues that need to be addressed in the, in the healthcare system, such as implementation of the existing legislation that we have. In some instances, we might need to look at, at tighter regulation, and of course addressing those enabling working conditions, or ensuring rather that there are enabling working conditions, for all health professionals in the public health sector.
Of course, and Dr. Flavia, now I just want to know, so I've seen a recent investigation by the BBC, it was, wherein they uncovered the situation in the Eastern Cape, which is, of course, South Africa's most poverty-stricken province. It's the most poverty-stricken province in the country. And some of the issues that were highlighted in that investigation was perhaps equipment shortages as well as some of the issues which Professor Rispel just mentioned, equipment shortages, tough working conditions where doctors have had to clean the hallways of hospitals in the case of the Eastern Cape. I'm not sure how prevalent that might be in the rest of the country. But as I said earlier, coming from the medical field, you are more familiar with the issues which are faced by this healthcare system. So if you might would just want to elaborate on that, what are some of the issues which the key issues which we are currently facing in the healthcare system at the moment?
So I want to say that, I mean, it's not only doctors. I mean, some of the people who are really quite frontline and very much unsung heroes and heroines in our health system are nurses. So it's broad. We have a number of, I like to rather use the term health professionals, which will encompass everybody who works in the, in the health sector. I mean, somebody who is a porter is critically important. Somebody who is a porter in the hospital is critically important. So one of the things, as Professor Rispel said, is leadership. I mean, we cannot emphasize the issue of leadership more than anything else. For instance, at the University of Pretoria, we run a program called the Albertina Sisulu Executive Leadership Program in Health. And one of the things that that program aims to do is really to capacitate people to lead the health system, because the health system is so complex and it's so nuanced, and so it is important when you sit on that chair to at least have had some knowledge about how to lead. And so issues around leadership and governance are extremely key. We cannot underestimate the issue or underscore the issue about disease burden. We are a country which has got a quadruple burden of disease. I mean, many African countries who have similar health systems to ours actually have a triple burden of disease. And so that push and that magnitude that is needed in terms of treatment of our patients is massive in terms of challenges in our hospital. Infrastructure and development is also very important. Infrastructure in terms of everything, the equipment, the buildings, and those kinds of things. And as Prof. Moshabela also said, the issues around funding. You have to invest if you want quality. And I think, one of the things that you will hear me harp on a lot is around community. In the past, even if we knew that this hospital belongs to this community, and so as a community would take care of it, would have activism, would find ways, you would hear slogans like Vukuzenzele, which means wake up and do it for yourself, and the Kenyan Harambe, which is wake up and do it for yourself. So you have communities rallying, and then you would have missionary hospitals and that. And so we have to go back to that community spirit, support our doctors, support our nurses, support all our health professionals, and understand that the health system, yes, it is shepherded by the government, but really we also have got a say and an ownership as a community. So we cannot be passive recipients, and we have to be active participants in terms of the kind of healthcare that we receive. Even if you're sitting on on your clinic, primary healthcare, your clinic committee or the hospital committee, it is still good enough in terms of making sure that that community voice is heard. It is so critically important, because let me tell you something, Zahid, as much as we sit and we do the research and we read the papers and everything, communities know what is happening. They know what is happening, and we come with our fancy terms, quadruple burden of disease and that, but the community will tell you, no, we've heard that, but you know what? We believe that in order to make our community and our population healthy, these are the things that we as a community think that you should be implementing. Because as Professor Rispel said, we talk about the social determinants of health. Again, if you look at, for instance, TB, you have to go into the community, do the tracing, check, yes, you've got this index case at the hospital and somebody has got TB, but what is happening in the community? So you have to bring people who build the houses. Is this house adequate enough in case we bring this person back home? Who else is in this household, etc., etc. So some of the things that make people sick are outside the health sector. So again, it's a whole community, whole system approach. As much as we have all these challenges, which are health related, but the community challenges are also key. And some the thing that has really shown it is the issues around gender-based violence, right? And so if we don't deal with toxic masculinity, which is as a community, we will continue, even if we put programs in place to stop gender-based violence as one of the contributors of a burden of disease. If we don't put community structures in place to talk to our girls, our men, etc., it's going to be difficult to deal if we use an example of gender-based violence.
Of course, and I do admire that that community idea of yours, that instead of being passive recipients of healthcare, we should actually be active contributors towards the healthcare sector. And of course, we should be grateful and thankful to the healthcare professionals for actually being on the front line during this pandemic. Anyway, it's 34 minutes past 7 p.m. Central African time. It's time for us to take a quick ad break. And when we get back, we'll read some of your comments from the listeners, and we'll also further this discussion. Please do stay tuned.
This is Salam Media, coming to you live from South Africa. With over 80 years of experience, IG Hussein and Company are renowned for their quality Islamic wear and goods. IG Hussein and Company stock a variety of Islamic items, musallas, kitabs, Medina dates, perfumes and exclusive gifts. We guarantee you a unique and friendly shopping experience for the entire family. Visit our new branch in Overport at 202 Kenilworth Park, Brickfield Road. Open 7 days a week with ample parking and wheelchair friendly. Like us on Facebook or Instagram at IG Hussein for our latest promotions and updates. IG Hussein and Company, your Islamic lifestyle.
Dad, well, I've been chatting with an investment broker today and...
Broker? Did the broker tell you that our economy is a mess? There's bushfires in Australia, America wanted World War III, and now the coronavirus is traveling around the world.
Well, I also thought about purchasing some crypto.
Crypto? What's that? Like another pyramid scheme? I don't trust what I can't see.
There's an apartment in Belito.
So all your family will be asking to stay there for free. And what if the government takes it away, eh?
Dad, I don't think it works like that.
I'll tell you what works. Gold. At your age, I invested in gold coins and it paid for your university fees and your wedding. No contracts, no agreements. Your investment is in your hands and you own it. With a 70% growth in only 5 years, do you still doubt gold investment? Contact RJ Coin today, 031 202 4701, or visit them at 151 Stephen Lamini Road in Musgrave, Durban. Randery Jewelers Gold Coin Exchange, your passport to gold investment.
Once again, Maulana Timol will be doing the annual Qurbani. Many people in the villages live well below the poverty line and only eat meat on the days of Eid al-Adha. Support this cause at 1,750 Rand for 7 shares or 250 Rand per share. Contact Maulana Timol, Maulana Sajjad, Maulana Hamad or Maulana Abbad on 011 852 6324 or 8538 or 8613 or 072 299 9268. All slaughtering will be supervised by a team of foreign ulama. Visit www.operationqurbani.org.za.
Welcome back. You are tuned to the special focus with myself, Zahid Jadwat, on Salah Media. We are together until 8 p.m. and we have just about 22 minutes remaining. What we are doing, if you've just joined us, we are discussing the state of South Africa's healthcare system. Let me just remind you, once again, our guests. Firstly, we have Professor Moshabela, who is the Dean in the School of Nursing and Public Health at the University of KwaZulu-Natal. We also have Professor Laetitia Rispel, who is the former head of the School of Public Health at the University of Witwatersrand. And last but not least, we have Dr. Flavia Senkubuge, who is a specialist of public health and head of health policy and management based at the University of Pretoria. To the listeners, just remember that we are looking forward to hearing from you. We want to know what it is that, what are your thoughts on this topic as well? What do you make of the healthcare system in South Africa? Do you perhaps have any ideas for what could be possible solutions? We do certainly want to hear from you. Remember that you can send us a WhatsApp text message to 061 766 0355. Let me just repeat that number. It's 061 766 0355. Alternatively, you can tweet and tag at Salah Media or at Zahid Jadwat, but please don't forget to use the hashtag The Special Focus. And you can also leave a comment below on our Facebook and YouTube broadcasts. If you do not necessarily want to ask a question for our guests or pose a comment, for example, you can at least certainly just leave a thumbs up or whatever symbol you'd like to leave, just so that we know you are tuned in and that you are enjoying the show. Let me look at some of the comments. Firstly, we have a comment from Nazlu Asmal here, who says, my grandmother was ill with the virus and we were told that there were no beds or ventilators available. And I think that's part of this broader discussion that we've been having before the ad break about the situation with South Africa's healthcare system. And I think one of the important points which were made by our panelists this evening is we need to make, Professor Rispel in fact said so, we need to make a differentiation between public healthcare sector and the private healthcare sector. So that's just one of the comments coming through from Nazlu Asmal. One more quick comment here quickly before we move on. I see from Elizabeth on Twitter, who says, ask them why the flu was never classified as a pandemic, and ask them why TB or AIDS was never classified as a pandemic, or Ebola either, as these illnesses seem to kill more people than COVID-19. I think that, Elizabeth, is a conversation which we will have in the coming weeks, because right now we are discussing the state of South Africa's healthcare, not necessarily COVID-19 on its own. So I think that's something we need to discuss and look at in one of the coming weeks. We'll definitely pick up on that, of course. But now coming back to our discussion for this evening. So Professor Moshabela, if we could just start with you now. So just less than half of the population lives in rural areas, but only 3% of newly qualified doctors take jobs there. How has this impacted access to healthcare in rural areas?
Yeah, I mean, that's also an interesting question. And And also, I think personally, I've also invested a lot in working in rural areas, and there are all these communities of healthcare workers that are committed to working in rural areas long term. So what I can say is that there've been positive impacts and negative impacts, and I'm going to emphasize the positive ones. But I think just the negative ones is we know that because of the maldistribution of healthcare workers, it limits the resources available to the people and communities in those areas. That is one thing. Then we also know that because of that, it makes it, and the distances between the rural areas and the cities and referral hospitals, it also means that a lot of patients that need to be transferred to cities or higher levels of care struggle to get there. And if the emergency medical services are not working optimally, then we have a problem. But just to emphasize some of the positive things is that because the doctors are limited, the functioning of healthcare services in rural areas rely a lot on teams. And I think it's something that Dr. Senkubuge already mentioned. The idea of healthcare teams, they leverage all the other healthcare workers that are available in those areas. And so the healthcare team become a major unit of delivering healthcare with support from nurses, therapists, pharmacists, and others supporting the doctor. Then the next thing that they've been able to do is to integrate better in communities. They work very well with local clinics, with community health workers visiting households. And so there is a much better integration with communities in rural areas compared to many of the urban areas. And all of these things, we could think of them in terms of task shifting and cooperation and partnership with local communities and participation of local communities. All of these things are supposed to be the essence of primary health care, even though, we haven't done a good job in terms of proper health promotion. But in rural areas, we depend a lot on primary health care in order to provide services. So, and I've seen also that a lot of the people that stay long in rural areas become very creative. They come up with very creative solutions in order to optimize care and services. And so it's an attribute that I think we should also highlight. And in recent years, as I said, we've seen people who work long-term in rural areas starting to organize and become part of the civil society in order to advocate for services. And you would hear a lot about the Rural Health Advocacy Project. You would hear about Rural Doctors Association of South Africa, or Rural Rehab of South Africa, and so forth. All these communities are now coming together in order to optimize healthcare in rural areas.
Of course, and just before we move on, would any one of the other panelists also like to weigh in on that? Perhaps Dr. Senkubuge, you might want to say something, because what Professor Moshabela just mentioned is some interesting and encouraging points mentioned by Professor Moshabela about the rural state, the state of rural healthcare in South Africa. He's been speaking about how the community has come to the assistance of healthcare professionals in the rural areas, and that's exactly what you were speaking about, Dr. Senkubuge. So you might want to pick up on that, or should we move on to the next question?
No, I think that's absolutely, and Professor Moshabela has said it all. And I think one of the things that he highlighted is the issues around innovation. And so, for instance, if you look at some of the things that we could borrow from other countries, in Rwanda, they've got a health system that they call Mondiale de Sante, and they have used it so beautifully in terms of using some of the innovative technologies, like using drone technology in terms of delivering medicines and that. And I think that's one of the things that in South Africa we will need to partner with, companies that are using, these innovative technologies like drones and some of the things that in the South African health system that we have done so well is using, for instance, cell phone technology around, reminding people when to take their medication, when to come and pick up their medication and that. And so rural healthcare has, one of the things is that has always been a criticism is that it is so far away from what is happening. But now, because we have technology, you will be able to even support the health professionals who are in the rural areas in terms of even just upskilling them. They'll be able to, say, for instance, have a Zoom class or having a Zoom meeting with a colleague to say, how do I assist this patient and that type of thing. So I think additional to all the wonderful things that Prof. Moshabela has said, the other beautiful thing that has happened in rural healthcare is the very wonderful use of technology in order to advance that space.
Of course, and that's also one of the other things which the COVID-19 pandemic has shown us, is that how we can use this technology to advance the way we do things. And of course, that would be what you've just mentioned, both of you. It encourages us to be optimistic about the state of rural healthcare in South Africa. But now, since coming to power in 1994, the ANC government has implemented measures to combat health inequalities in South Africa. Now, this includes the introduction of free healthcare in 1994 for all children under the age of 6, together with pregnant and breastfeeding women making use of public sector health facilities, and the extension of free hospital care in 2003 to children older than 6 years old with moderate and severe disabilities. Have measures like these, this is a question now, Professor Rispel, have measures like these been effective in addressing the issue of inequality in terms of access to healthcare?
So Zahid, my learned colleagues have already highlighted, some of the successes, and you've just read a whole lot. So I think I would be one of the first people to acknowledge the progress that has been made. However, the South Africa remains one of the most unequal countries in the world, and that's really the issue that you're talking to now. The issue of inequities. But when we talk about inequities in access to care, we can't really separate that from broader social and economic inequities. So, for example, at the last quarterly labor force survey, it was Statistics South Africa told us that we now have the highest, in the last quarter, the highest unemployment rate was recorded. And remember, the quarterly labor force survey actually gives you figures of people that are looking for work. And so it excludes those individuals that might have given that might have given up to look for work. Last week, the National Income Dynamic Survey revealed that between lockdown and the end of April, 3 million people lost their income, and of those 3 million, the majority were Black African women. So I think we can't separate the inequities in the healthcare system from those broader social and economic inequities. And so, yes, of course, there has been progress. We have in South Africa, we have the largest antiretroviral treatment programs. Our social assistance program is also, commendable. But these measures in themselves are insufficient to deal. We have to deal with those broader inequities, both at a social level as well as at an economic level, and then together with the inequities in the healthcare system. And I just want to remind all of us about our constitution, which actually makes it a responsibility and incumbent on all of us to take measures that begin to redress those social and economic inequities. And in the process, look at, so health inequities, access to care, those issues we have to continue to address, access to, to doctors and other health professionals in the rural areas. So when we look at some of our large tertiary hospitals here in the province of Gauteng, where Dr. Senkubuge and I and you are, some of the total number of doctors in two of the central hospitals in Gauteng are more than the total number of doctors in the province of Limpopo. And so it means that for somebody who sits in the Limpopo province, it's extraordinarily difficult to access specialist services. And those are the kinds of inequities that we have to address. And I think similar inequities also relate to other health professionals, but nurses are probably the one category of health professional that's more equitably distributed compared certainly to medical specialists that are very inequitably distributed. And those inequities are both between the public and private health sector, as well as between urban and rural provinces.
Yeah, of course, and inequality is something which is one of the broader issues faced by South Africans on a daily basis, and there are historical factors which need to be taken into account when we look at these issues. But let's now look at the way forward. How do we move forward now? Because there's no use like really speaking about these issues, but not really giving suggestions and sharing ideas of how we can improve our healthcare system and how we can improve these issues and how we can fix them rather. So I want an input from each one of the panelists. Just your idea how we can actually fix these issues and move forward. Starting with you, Professor Moshabela, and then Professor Dr. Senkubuge, and then Professor Rispel.
Yeah, I think that Professor Rispel has already mentioned the issue of the South African society being unequal. I think many of the solutions that we have to put in place in order to fix the health system are actually in society as a whole, rather than specifically in the healthcare system. So there's a lot of problems in our society. In as much as it is a strength that we are so diverse, we have not been able to leverage that strength. In many ways, it has been a negative that's caused us to be so fragmented, and we are not able to work in solidarity. But at the beginning of the lockdown, we could see that starting to happen, where people were actually coming together in solidarity to be able to support health. And it was that example that kind of was a spark of light to say, actually, we could in our society come together to deal with the problems that we have. So that's one issue for me. But the second part for me, I think, is that we cannot continue with a system that is so largely curative that people depend on the expertise of medical professionals and health professionals. We need to get to a point where people are empowered to take care of their own health and also start to emphasize preventing disease and preventing severity of disease a lot more than treating disease. And if we can do that, then we wouldn't have a problem having to encourage people to wash their hands. But we haven't done that very well before, which is why now we are under pressure to do it. So if we can get people if we can focus on empowering people to focus on to promote their own health and take care of their own health, and instead we create enabling environments and policies, and we support them to take care of their own health, and we start to value that. That for me, I think it will take us a long way in order to kind of shift the pressure on the healthcare system and have the space to be able to develop our healthcare system in a way that is a lot more developed. I'll leave it at that for now, but I think that, I'm sure Professor Rispel will comment on the, inequity between private and public sector, but I'll make those 2 points. Thanks.
Yeah. Okay. So for you, Professor Moshabela, I think it's more about empowering people, the general, broader public, to actually take care of their own health, and in that way we can shift the pressure of that's being applied on the healthcare system. But for you, Dr. Senkubuge, what is it that you think might actually help us fix our problems that we face in the healthcare system?
I'll kind of say it in a kind of philosophical way and say one thing that we all need to understand is that we are each other's keeper. Going back to the old adage of the African adage of Ubuntu, you know, I am because we are. That is so critical. So for us as leaders in the health fraternity is to lead with humility and grace and not forget to bring the community along. And when I say community, I mean, you know, everybody that we lead and the communities where we live. The other thing, which I couldn't agree more with Professor Moshabela, is, you know, to empower our communities and to say to our communities and your listeners that you have a voice and use that voice. Your voice, don't mute your voice and just say, if you have an idea, go to your ward councillor, go to whoever, and you know, knock on their doors and say, I have this idea. We talked about innovative technologies. There are many people in our community who have an idea of how we can sort out COVID-19, and they should go chat to their ward councillor and don't stop talking to them. So is that community empowerment and ensure that you're an active participant in all the health conversations, not just only COVID-19.
Yeah, okay. Unfortunately, we just have 3 minutes remaining, so this is where we are going to have to wrap up. But before we actually go, Professor Rispel, you might want to now give us your ideas as well as to how we can improve our healthcare system. So Professor Moshabela spoke about taking care of our own health as the general public, and Dr. Senkubuge also speaking about that sense of community that we need to build, and speaking about the spirit of Ubuntu as well. And it's innovative ideas we're coming up with this evening. But for you, Professor Rispel, what is it that it would take to now improve our healthcare system? Of course, we are dealing with massive inequalities, which we spoke about just now. And I think we hardly have much time to go into the NHI discussion, the National Health Insurance, and how, well, I would like to know your thoughts, how that would assist us, if it would, with addressing inequality. Just maybe you might want to wrap up on that, just as brief as possible, Professor.
So in your last minute, Zahid, I would say 3 things. One is I would focus on leadership, management, and governance, ethical leadership. The second aspect is I would invest in our health workers. And then thirdly, I agree with my other colleagues, and I would go beyond empowering communities and say, let's partner with communities to provide responsive, high quality care. And I'll leave it at that.
And we did not even get to a chance to go into the NHI discussion, and that's of course one of the major issues, which is taking it's taking part of the it's taking the stage of the health discussion, the discussion of healthcare in South Africa. But unfortunately, that's where we're going to have to leave it with just 1 minute to 8 o'clock. Let me thank each of you for joining us this evening and for your valuable contribution. It's been absolutely fantastic speaking to you guys this evening. Thank you for your contribution, and thanks for your time.
Thank you.
All of you.
Thank you. Thanks, everyone.
And unfortunately, that's how we come to the end of yet another episode of the Special Focus. From myself, Zahid Jadwat, and the team, thank you so much for tuning in as usual. We do really appreciate your feedback as well. So please do send those through. You can send them to info@salammedia, or you can tweet and tag @salammedia. But from myself, Zahid Jadwat, and the team, Assalamu alaikum wa rahmatullahi wa barakatuh.